The PreCheck Health PC8B is a medical screening device and a powerful tool in managing a patient's health. The PC8B is FDA cleared and patented, with the data system making use of multiple technologies, including photoplethysmography, volume plethysmography, ankle brachial indices, oxygen sensing, and galvanic skin response. The device includes wireless and Bluetooth connections to increase patient comfort and technicians' ease of use. Using components that are non-invasive, painless, and quickly and easily applied to a patient, the PC8B specifically assesses risk factors for autonomic nervous system dysfunction, pseudomotor dysfunction, cardiac autonomic neuropathy, endothelial dysfunction, small fiber neuropathy, cardiovascular disease, insulin resistance. The PC8B provides predictive markers for these dysfunctions using a cardiometabolic risk score and a mathematical analysis and proprietary algorithm derived from the collected body signals and measurements. These markers, along with a patient's body composition, vital signs, and overall fitness, enables a doctor to determine a patient's chance of having or developing diabetes, heart disease, or stroke. The device offers a better, faster, and easier approach to screening for many health issues at their very early stages.
The PC8B is an invaluable instrument that's pretty much, in my estimation, required in every single doctor's office, hospital across the world. Why? Because the information it gives about a patient is typically not only groundbreaking and creates a benchmark for that patient's long-term health, it also allows us to know where that patient is on a timeline from good health basically to poor health, from cardiovascular risk to insulin resistance to basically whether or not overall the patient's autonomic nervous system is working well. The PC8B is a simple non-invasive test which just basically takes 10 to 12 minutes. The patient lies down on a table and you place a little clip on the finger to measure the pulse width velocity. A blood pressure cuff is put on the patient's arm, and then some pads are just put on the feet. And with that, in about 10 minutes, and asking the patient to maybe hold their breath at one point or bear down or just sit quietly, that test compiles literally dozens of pieces of information to let the patient know, and you know particularly, what sort of medical protocol may be important for them. It's an easy, very non-invasive, and so informative test, it makes sense that we all have one done. For PreCheck, I'm Dr. Mitch, Chief Science Officer.
A patient screening with the PC8B is generally covered and reimbursed by Medicare, Medicaid, and most insurance companies. The Centers for Medicare and Medicaid Services, or CMS, is moving aggressively towards a preventative health model. CMS now reimburses for wellness visits as well as other preventative care actions. CMS understands that preventative screening and early diagnosis now can drastically reduce the costs of chronic diseases in the future. The PC8B is a very sophisticated and expensive medical screening device. In light of this, PreCheck Health Services has developed a licensing model rather than an outright sales model for the PC8B. This licensing model eliminates the need for a physician to make a large equipment purchase with a personal guarantee and a credit check. A physician can cover the costs for the use of the device in the first month or two of use. We require no long-term commitment in a typical commercial lease. Depending on the state and the insurer, reimbursements can be significant. A few tests per day can generate well into 6 figures of annual reimbursement for a single doctor or small clinic. When the physician or practice enters into a license agreement, we provide the PC8B medical screening device, one-on-one training and access to our video training, full technical support and warranty, customer service, continuing education, report interpretation service by our Chief Science Officer, processing and adjudication of claims. The PC8B has been proven by doctors across the U.S. to benefit their patients by detecting and possibly even preventing chronic diseases at an early stage. Our device benefits doctors because they can now be reimbursed for preventative care of their patients and receive significant revenue.